Okay, welcome. My clock says 12:15, so we'll get started right on time. Our topic today is choosing smarter, building your cognitive 401k. I am going to be talking today about how to prevent dementia. I've been a primary care doctor at Sutter for the last 15 years, so the way we're going to talk about this is using evidence-based strategies in a very practical way. I'd like you to go home with a full set of actionable things that you can do to feel confident about preventing dementia in your future. Thank you to those of you who have already submitted Q&A questions. I've got some juicy slides at the end based on those questions. A lot of your questions will be answered during today's talk, and we'll get through some live questions at the end. Okay, but first, an invitation. Studies suggest that retention rates from lectures like this are about 30% at best, 5% when you're multitasking. So something about you, your intuition, called you to be here today. So follow your intuition. I invite you to truly be present for the next 1 hour. Let's put those phones aside. For all of you live streamers out there, close those pop-ups in those email windows. And together, I invite you to take one deep grounding breath with me today, maybe the deepest one you've taken all morning. Just when you're ready, take a big breath in. Hold it for a minute. Just let it out nice and slowly. And with that, we're going to dive in with some basic anatomy. On the left of your screen, you're going to see a healthy brain. Nice, fluffy purpleness. In the middle there, with an H, is the hippocampus. This is the learning and memory center of the brain. This is a very important part of the brain because it's the part we're going to try to keep nice and robust to prevent dementia. The brain is made up of a bunch of cells called neurons in the brain. And you'll see me and hear me refer to something called BDNF, brain-derived neurotrophic factor, BDNF. This is like Miracle-Gro for the brain. So pay attention to all the things I mentioned today that are like Miracle-Gro for the brain, BDNF. On the right side is the Alzheimer's brain. Now I'm going to be using the terms dementia and Alzheimer's interchangeably today. Alzheimer's makes up about 75% of dementia, but in reality, everything we talk about today will prevent all forms of dementia. The brain on the right is a little bit shrunken down. That's atrophy. The hippocampus, therefore, is a little bit smaller. And you'll notice those neurons, those brain cells, have these tau neurofibrillary tangles and these amyloid beta proteins. These A beta proteins sort of gunk up the works, keep the signaling from happening between the brain cells, and therefore affects memory and function. You'll also hear me talk about the ApoE4 gene. This is one of many genes that can play a role in dementia risk. And we'll talk about how, in fact, you are not your genes. And we'll talk about some studies that show you your genes actually don't matter so much if you make the right choices. So this is going to be our guide, our pathway today on how to prevent dementia. Choosing smarter. You don't actually have to work harder. Just make smarter decisions along the way. So we're talking about nourishing, slumber, breathing, moving, detoxification, and your thought patterns. Signs consistent with Alzheimer's disease can be detected in the brain 20 to 30 years prior to diagnosis. So now is the time to start. We don't want to wait. So nourishing, food, right? So complicated. Every day there's a new diet being touted in the media. So complicated. Well, it's actually not that complicated. So many of you have heard about Michael Pollan, widely acclaimed author and journalist, and he managed to sum up over 10,000 research studies in just 7 words. Eat food, not too much, mostly plants. Eat food. What is real food? It's something that your great-grandmother would recognize as food. So not in a package, not in a drive-through window, right? Probably from the ground. Not too much. We don't want to stuff ourselves. Eat up to 80% full. Let it sit, and mostly plants. So what does that look like in reality? Hopefully this looks familiar. This is the Mediterranean diet, right? What do we see here? Lots of colorful vegetables, olive oil, nuts, whole grains, fruits. More importantly, what do we not see here? There's no refined sugar, no soda, no fried foods, no packages, right? So the Mediterranean diet has been well established in terms of preventing cardiovascular health. Cardiovascular disease is the #1 killer in the US, so we all should be doing this anyways. But there was a very interesting study that actually took this diet and added an extra serving of vegetables and specifically chose berries over other fruits. This was called the MIND diet. And what we were able to show is that those who stick with the MIND diet over a 5-year period had a 40% decreased risk of dementia. 40% decrease, and this was independent of genetic risk factors, ApoE4. Okay. Another fascinating study done, published in Neurology. So Neurology is one of the major peer-reviewed journals in medicine. They tracked 30 to 50-year-olds, young people. Remember I said Alzheimer's can be detected 30 years prior to diagnosis. So we looked at 30 to 60-year-olds, and we took a scan of their brain looking for amyloid plaques before and after a 3-year window. And what we saw are the 30 to 60-year-olds who stuck with this MIND diet most avidly actually had less amyloid plaque built up in their brain in just 3 years. So the decisions that you make every day with your meals make a difference in the plaques that gunk up the works in the brain, okay, even when you're young. So I invite you to think about when you get up in the morning, how are you gonna get closer to this diet? How will you add an extra few servings of vegetables? Because these decisions are what makes a difference. Nourish smarter to increase that cognitive 401k. So just as important as what you eat, perhaps, is how you eat it. So there's this notion of time-restricted eating with an overnight fast. I don't know about you, but many of my patients like to go home, they eat, and they drink a little, sit on the TV, eat some popcorn. We're just kind of nibbling all the time. When you're eating all the time, the body's very distracted and doesn't have time to clear out the waste. So what we're thinking about is reducing the eating window, in a strict version of this, down to 8 hours. So it might look like waiting to eat anything in the morning until 10 a.m., perhaps finishing all your calories for the day by 6 p.m., and having fasting for the next 16 hours with water or herbal tea. Now that 8-hour window can be shifted anywhere you want. That's pretty strict. Some people like to do 10 hours at a very minimum 12-hour eating window, okay? So what we've been able to show is that those with ApoE4 gene do best when they do the strictest version of this with an 8-hour time restriction. So why would we do this? Studies have shown that when you have a 16-hour fast or something close to it, you get improved insulin sensitivity, less inflammation in the body. There is an increase in autophagy. Autophagy is the body's ability to take away the dying cells. So we want to keep the body nice and clean with the robust cells, take away the dying cells. And here's that key word, BDNF. Intermittent fasting or time-restricted eating increases BDNF, brain-derived neurotrophic factor in the brain, the miracle grow for the brain. So there's no medicine that can do this, there's no supplement that can do this, but you can choose to do this by nourishing smarter. Okay, slumber. Now slumber, I know this is the lunch hour, so we're gonna wake you up with a little bit of multiple choice here. Pertaining to sleep, which of the following are true? A, blue light found in bulbs and electronics adversely affects melatonin production and therefore sleep. Well, I can tell you this is true. We have a lot of data that blue light found in all electronics, even LED lights and TVs, affect your melatonin production. The pineal gland in the brain produces melatonin. This is a hormone that affects your circadian rhythm. It also has a role in immune system function and tumor regulation. And so when we do watch TV into the night, this affects our melatonin production. Now, most of you who are watching and here today are savvy enough to pick up most of your electronics and find the night shift mode. The night shift mode in your electronics will cut out the blue light from sunset to sunrise. So I encourage you to make that small step today. B, Ambien, Zolpidem, a common prescription sleeping pill, has been shown to increase the risk of dementia by 3-fold with chronic use. Can that be true? Do doctors prescribe medicines that cause dementia? Yes. So this is something where we want to try to cultivate natural, healthy sleep, and we can talk about that a little bit more in a bit. So I encourage you to work with your practitioners if you're on chronic sleeping medications to get off of these naturally. C, sleeping is like the rinse cycle of the dishwasher. What does that mean? Well, since we know that A and B are true, then D must be true, all of the above. Let's talk about that rinse cycle a little bit more. So the brain has waste products. We talked about A-beta proteins being one of those waste products. And it turns out that when we sleep, and the longer we sleep, the more we're able to clear those products from the brain. And in fact, this was only discovered in 2013, not too long ago. It's called the lymphatic drainage system of the brain. And when we sleep, these extracellular volumes increase by about 60% to help clear the waste from the brain. So sleep is important. Slumber smarter to prevent dementia. Another multiple choice question. So pertaining to sleep, which of the following are true? A, even one night of missed sleep can result in increased A-beta deposition in the hippocampus. That's in fact true. We took some poor schmucks who needed some money, deprived them of sleep for a night, did a scan before and afterwards, and specifically can see increased A-beta protein damaging the hippocampus. Now, fortunately, the body is resilient. We are able to clear that A-beta waste with time, but what we know is that A-beta can build up with chronic sleep deprivation. B, untreated sleep apnea increases dementia risk by 26%. Now, I've been doing primary care for 15 years. I think that undiagnosed sleep apnea is one of the main missed diagnoses. So if you wake up with morning headaches, not feeling refreshed, feeling like you need to take a nap, high blood pressure, weight gain, those are just a few of the many symptoms that can be signs of undiagnosed sleep apnea. It's worthwhile to talk with your doctor to see if you need a test. And C, optimal sleep for brain health seems to be 7 to 9 hours per night. Now that really may seem like a luxury. We have a lot of things tugging at us that may not keep us or not allow us to do 7 hours of sleep. I encourage you to take a look. Many of my patients choose to wind down at night by watching TV for an extra 1 or 2 hours. From a medical standpoint and from your brain standpoint, the 1 and 2 hours added to your sleep would do a whole lot more. So all of the above are true. So make the choice to prioritize sleep, slumber smarter, to add to your cognitive core 401k. So, breathing smarter. So I chose to write down breathing instead of meditation because I didn't want to freak anybody out, okay? So let's just start with breathing. Stress increases dementia by about 25 to 40%, chronic daily stress. So what is the antidote to that? Breathing, relaxation, and in fact, most of the research is done on meditation. So for any of you daily meditators out there, congratulations. We see that after a few decades of daily meditation, when we compare brain sizes of equal-aged individuals, the average brain size of a meditator looks about 7.5 years younger than non-meditators. Now, don't worry if you haven't started meditating yet. There's a really interesting study done by Sarah Lazar at Harvard where she took people and put them through the MBSR class, mindfulness-based stress reduction class. This was an 8-week class. And for this study, these participants were asked to meditate for an hour a day for the study. And what we show is on the y-axis, the change in the GMC, the gray matter cortex. In just 8 weeks of daily meditation, we were able to see growth in the hippocampus, the memory center of the brain. And that's noted by the colorful markings on the MRI there. So why does this work? Well, breathing decreases stress, increases resilience. There's the key acronym again. It increases BDNF. It increases brain-derived neurotrophic factor. That's the miracle grow for the brain, and protects against atrophy. So many of you have been able to have access to the very same course that this research was done on, mindfulness-based stress reduction course. Sutter offers this at most of their major sites, as do most other large medical groups. For those who don't have access or who want to get started today, I've put a few of my favorite meditation apps. These apps will generally take you through the beginning processes of learning how to breathe and coming to center. For you skeptics out there, the 10% Happier app seems to be a good one. I like to recommend Calm and Headspace. My personal favorite is Insight Timer. I use that every day, but not as good for beginners, but it's good for if you like some more options. So choose to breathe smarter to increase that 401k. Now, the very first step in learning meditation is learning how to breathe. So I'd like to take just 2 minutes to guide you through a practice. This is called 4-7-8 breathing. I learned it from my mentor, Dr. Andrew Weil. He's also the one who started my Integrative Medicine Fellowship in Arizona. So we're gonna talk through how to do it, and then we're gonna do it 3 times, okay? So the first tip is to sit up straight. There you go, feet flat on the floor. You're gonna place the tip of your tongue just behind the upper teeth, and when you exhale, you're gonna exhale around your tongue, okay? And to walk you through it, we're gonna have you exhale, and then inhale deeply and fully through the nose through a count of 4. You're gonna hold for a count of 7, and then slowly whoosh out to a count of 8, and we'll repeat that 3 times. The first time I'll cue you heavily, the second time I'll cue you a little less, and the third time we'll do it in silence altogether. So when you're ready, I invite you to close your eyes, just fully exhale. And when you're ready, take a deep belly breath, fill up your belly, fill up your chest, 2, 3, and 4 all the way, and just pause, 2, 3, 4, 5, 6, 7, and start to exhale slowly and completely all the way out, 5, 6, 7, and 8. Now, the next time on your own, you're going to go ahead and exhale, and then go ahead and start to inhale deeply and fully, breathing in relaxation and calm all the way in. Hold for a count of 7. And then as you let it out, breathe out stress, breathe out worry, breathe out that tension in your shoulders, all the way out nice and slowly. So we're going to do one more 4-7-8 breath. I'm going to do it with you. We're going to be silent when you're ready. I hope at least a few of you are feeling a little bit more relaxed, a little bit more calm. The research shows that whenever our out-breath is longer than our in-breath, automatically our central nervous system triggers the parasympathetic system, which is the rest and relaxation mode. Our blood pressure comes down, our heart rate comes down, our inflammation levels come down. So this is something you have as a tool in your toolkit. When you're getting stressed, you're in traffic, that meeting's about to start, you're annoyed, you can always stop. That took us less than 2 minutes to do of the 3, 4, 7, 8 breaths. And perhaps this might be your entry portal into a daily meditation practice. Okay, now to movement. This should not be a news flash for you. Movement and exercise are important for your body and therefore your brain. Sitting is the new smoking. So, multiple choice. Based on clinical research, a 35% reduction in dementia is seen in patients who, A, work 10 hours a day at a desk job. No. B, commute by car an hour and a half a day. Probably not. C, play computerized brain games like Brain HQ for an hour a day. Intriguing, but for you smart test takers, this is a movement slide. So D, walk an average of 6 miles per week. That is not a typo. 6 miles per week. That's nothing, okay? 6 miles at 2,000 steps per mile is just 12,000 steps per week. Hopefully your doctor has tried to get you to walk 10 to 12,000 steps per day for cardiovascular health, but as little as 12,000 steps per week, according to the cardiovascular health study, this was done in the 90s, is enough to decrease your dementia risk by 35%. I guarantee 100% of you here today have some sort of step counter on your body, whether it's a phone or a Fitbit or an Apple Watch or whatever. Check your numbers. Are you actually meeting this? These are very small numbers we're asking you to meet. So, just to drive home the point again, BDNF, okay, exercise increases BDNF. Miracle Grow for the brain. So now we have intermittent fasting, meditation, and movement increasing BDNF. This is going to decrease the brain shrinkage and increase hippocampal volume. So this was a study done in the 90s as well. At the crosshairs, you see the hippocampus, which is enlarging in the people who exercise the most. Move smarter, build your cognitive 401k. Okay, detox. Toxins are a personal passion of mine. We know that these can contribute to neurological decline. There are over 80,000 chemicals approved for use in the US. About 3,000 of them are actually tested for safety in humans. Many of these are neurotoxic, and we can detect these using specialized testing in the blood and the urine. So, regarding toxin exposure, which of the following are true? The 2019 Dirty Dozen list includes the vegetables and fruits listed here. Well, the Dirty Dozen list is published each year by the Environmental Working Group, and it includes the 12 most heavily pesticided fruits and vegetables in the US. They also published a Clean 15 list. So I would encourage each of you to remember to look up the ewg.org website at the end of today or end of the talk. I do think it's reasonable to choose organic fruits and vegetables, especially if they're on this Dirty Dozen list. And if you have the means to do so, all grains, meat, and dairy should be as well. We also know that what you put on your body is as important as what you put in your body in terms of toxin risk. So choose your personal and home care products wisely. This same website has some very great consumer guides showing the least toxic products. B, compared to the countryside, there's a 40% increased risk of dementia in urban dwellings within a 50-meter distance of a major highway. That is actually true. So if you see all those apartment buildings lined up right against the 101, 40% increased risk of dementia, and this has been repeated in multiple studies globally. And so how can you help this? Well, if you live in one of those dwellings, keep your windows shut and buy a HEPA filter. This is a great investment, and it'll take out most of those submicron pollutant particles in the air. The recirc button, something that I didn't really pay attention to until recently, but if you're sitting in heavy traffic during commute, using the recirc button can decrease the toxin exposure by about 80%. So it's worthwhile to do that in commute traffic. Why are pollutants such an issue? Pollutants are submicron toxins that go through your nose when you breathe them in, straight through the very thin cribriform plate directly into your brain, triggering an inflammatory process. So we want to take down the amount of pollutants that we're breathing in. So that takes us to see, it's not surprising then, that smoking is associated with a 70% greater risk of Alzheimer's dementia. You're mainlining those pollutants into your brain, okay? And D, oral care may decrease oral bacterial toxins found in 90% of Alzheimer's brains. So what did I just say here? Oral toxins, bacteria and spirochetes, are found in 90% of Alzheimer's brains. When we have gingivitis, inflammation, don't floss, those bacteria are part of the inflammatory process that can trigger dementia. Incidentally, we see those very same pathogens in the plaques around the arteries. So oral care is full body care, okay? Floss every day. All right. So all of the above are true. So what does it then mean to detox smarter and use food as medicine? So first is keeping the toxins out. Second is allowing your body to have the tools to get this out. So this is going to be the scariest slide. This is a picture of the liver, and let me just walk you through it. The liver is the main organ responsible for taking a toxin, such as drugs, pesticides, food additives, household chemicals. The liver takes those toxins and puts them through a cytochrome P450 system to make an intermediary metabolite. That metabolite then goes through another pathway, packaged in order to be excreted from the body, either from stool or from urine. So if you take a look at the boxes in between, we see a lot of the nutrients that are needed in order for the liver to do this well. We need B vitamins, we need amino acid, we need antioxidants, we need a lot of stuff that is found in cruciferous vegetables. These are some of my favorites. We got broccoli, Brussels sprouts, cabbage, cauliflower. We got the allium group, garlic, onions, leafy greens, berries, green tea, protein. So this is not anything different than what we said in the beginning, right? Healthy choices, fruits and vegetables will help your body prevent dementia. And one of the ways it does this is by helping your liver to conjugate those toxins and get them out of the body. So what about sauna? True or false? Research suggests that a daily 20-minute sauna can decrease dementia risk by 65%. It's one of my favorite studies. This was actually just published last year. We're taking a lesson from the Finns. The folks in Finland have a sauna culture. Not a huge deal, some part in their day, strip their clothes off, go for 20 minutes, super hot sauna, wipe off and leave. And what we did was we looked at 40 to 60-year-olds, so again, prevention, starting young. We looked at the folks who did this 4 to 7 days a week and compared it to the folks who did it just 1 day a week. And they were followed for a period of 20 years. And the results, no pun intended, were mind-blowing, okay? 65% decreased risk of dementia in the group that chose to do sauna more than 4 days a week. And furthermore, there was a 40% decrease of all-cause mortality. Less heart disease, less cancer, less all-cause mortality. So obviously, this is not something that's right for everyone. Talk to your doctor. But if you have access, if you're at the gym anyway and just kind of ignored the sauna or ignored the steam room, you may want to choose, based on this data, to take advantage of it. Make sure you hydrate very well. If you have low blood pressure or other medical issues, talk to your physician first. But these set of slides are showing us that by avoiding toxins and detoxing smarter, we can cultivate our cognitive 401k. Okay, cultivating, speaking of cultivating, your thoughts matter, right? We are how we think, we are how we eat, we are how we move. This is my favorite study, published again just last year. So it's entitled Positive Age Beliefs Protect Against Dementia Even Among Elders with a High-Risk Gene. So this study is basically telling us about the mind, the spirit, the soul, right? What does it mean to have a positive age belief? I sage as I age. I'm getting older and wiser. Things are better than I thought they would be. I'm still useful. To be able to think these types of positive thoughts through your lifetime can predict dementia risk. So what we did is we looked at 5,000 participants in the health and retirement study, age 60 or older, no dementia at baseline, gave them a questionnaire, followed them for the next 4 years. And the results were amazing. There is a 50% decreased risk of dementia seen in the individuals who are able to espouse positive age beliefs on their questionnaire. So since this is a preventive talk, what are the things we can do to help cultivate these types of thinking? So start thinking about your sense of purpose, your community, your tribe. Do you feel connected? Are you cultivating love, both within yourself and those around you? Do you have hobbies, passions, volunteer work perhaps, spirituality and religion, gratitude, cultivating joy? This is a pillar of health that is just as important as the food you eat, the way you move, how you sleep, avoiding toxins. If you're needing help doing this, if you're feeling a little depressed, you feel like none of that really pertains to you, you don't know how to cultivate it, this is where a therapist can be helpful, a counselor, an advisor, or a life coach. Cultivate positive thoughts to increase your 401k. 50% decreased risk, independent of genetic factors. Okay, so we kind of took ourselves through this roadmap today. Eating right, choosing to sleep more, starting with breath work and perhaps meditation, movement, avoiding toxins, positive thinking. Each of these individually decreases your risk of dementia by at least 25 up to 65%. So imagine if you put them all together. You can do the math. So does this actually work? So there are at least 3 multi-domain studies that prove that this works. But my favorite observational study is that of the blue zones. So many of you may have heard of the blue zones. These are regions around the globe where people commonly live past the age of 100 years old. So Sardinia, Italy, Ikaria, Greece, Okinawa, Japan, Nicoya Peninsula in Costa Rica, and the closest to us here is Loma Linda, California. And in particular, the Loma Linda Seventh-day Adventists, vegetarians, no alcohol. Now, in these blue zones, we notice that there is 70% less dementia than in the average US. And again, this is at the age of 100, okay? So what do they have in common? Interestingly, very similar to what all of our research just showed, right? So in the blue zone study, they move naturally. They walk to the store, they're gardening outside, they walk to church, they have a sense of purpose and connectedness. They tend to relax. The sun goes down, let's relax, right? The 80% rule, remember Michael Pollan, eat food, not too much, mostly plants, okay? Identifying the right tribe, family, love. In the blue zones, over 90% of them belong to some sort of spiritual practice or religion. And then, yes, once you have that full package, most of the blue zones show that people came together in the evening socially and shared a glass of wine. That is not a requirement, and that comes after everything else is satisfied. And again, Loma Linda, they do not drink alcohol in the Seventh-day Adventist practice. But I do think in the grand scheme of things, when everything is in balance, a glass of wine is okay to have. So living smarter to cultivate your 401k, all right? Your cognitive 401k. All right, so now we have this choosing smarter checklist. Just to drill it in, we got the MIND diet, which is the Mediterranean diet with extra berries and extra greens. You have a choice to make with every meal. An 8 to 10 hour time restricted eating window with a 14 to 16 hour fast overnight. Increase that BDNF. Prioritize medication-free sleep, aiming for about 8 hours. You now know how to do the 4-7-8 breath anytime, and perhaps starting a meditation practice, signing up for that MBSR class. A minimum, absolute minimum of 6 miles per week. Checking out the Environmental Working Group website to empower yourself to learn about how to keep toxins out of your body. Perhaps embracing a sauna culture if that's available to you, and cultivating a positive attitude. Which one of these is your intuition telling you to start with today? You don't have to do all of them. Pick one and grow from there, okay? So, again, thank you to those of you who submitted questions ahead of time. I have a lot of juicy slides coming up in answer to those questions. And let's dive in, because I want to get through as many of these questions as possible. So one of the questions is, how common is dementia? Well, by 2050, 1 in 33 Americans will have Alzheimer's dementia. And why does 2050 matter? Because remember, Alzheimer's changes can start 30 years prior to diagnosis. So now is the time to make some of those changes. 1 in 3 seniors is predicted to die from dementia by 2050. This may outnumber those with diabetes and dying from heart disease and cancer. Thinking about your motivation to change, okay? Fear doesn't usually work, so you gotta dig deeper. Why do you actually want to prevent dementia, right? Okay, early symptoms. So one of the questions was, what are the symptoms of early dementia? Should I be worried that I sometimes forget names or lose my keys? So there are 10 typical symptoms that are discussed: memory loss, difficulty planning and solving problems, difficulty completing familiar tasks. This would be like the accountant that can't do math anymore, difficulty determining time or place, forgetting where they are in time. Depth perception loss, if you know someone getting a little bit more fender benders, that's a clue as well. Difficulty finding the right words, misplacing items, difficulty making decisions, starting withdrawal socially, mood changes. Now, I don't know about you, but I experience many of these on a daily basis. These can be influenced by sleep, stress, multitasking. So it's really not about thinking, oh, I have dementia. If these things are reversible in you, it's not likely an immediate concern. But if these are starting to build up and they're not going away or getting worse, that's when you want to be concerned. But again, this is a prevention talk, so hopefully we'll prevent any of these from happening. Okay, this is probably my most common question. Are there any vitamins or mineral supplements that I should be taking to prevent dementia? So a full discussion of this is way out of the scope of this talk. That's like a 7-day conference in and of itself. But I chose to highlight just a few of my favorites that I think will be safe for this average population to consider doing, okay? So remember, food first. All the supplements in the world will not do anything for you without a strong foundation. So now that you know that strong foundation, what are some other things to consider? Well, magnesium. So magnesium is found in a lot of the healthy foods in the Mediterranean diet pictured here. And we know that magnesium is involved in over 600 enzymatic processes in each cell in the body every day. So there's an interesting study that was published out of Taiwan. Taiwan has a good registry for health and medicine. So what they noticed is that if you looked at all the people who just happened to be given magnesium for another issue, palpitations or cramps, whatever, and then you look down the road at their dementia risk, there was a 40% decreased risk of dementia in patients who happened to be taking magnesium for another issue, okay? Magnesium is really important. We'll talk about dosing on the next slide. Turmeric. Turmeric is nature's anti-inflammatory. Remember I mentioned that dementia is really an inflammatory process. So turmeric is nature's natural anti-inflammatory. I like to put this in smoothies, sprinkle it on your eggs, put it into soups and curries, and really taking a capsule daily may be appropriate for some people, especially if you have other reasons to take it, such as arthritis. Omega-3 fish oil. Now, there's a lot of controversy about fish oil every other day. There's a study saying it's good or it's not good. But really, pertaining to the brain, we know that the DHA in fish oil can be helpful to promote brain health overall. And my favorite form of that is sardines. If I can get everyone to eat a can of sardines every week or two, that's an excellent source of omega-3s. It's probably one of the lowest mercury risks in terms of seafood, and a can of sardines actually has more calcium than a cup of milk, so it's an all-around good clean source of protein with a lot of side benefits as well. And this really isn't a food, but good old sunshine vitamin, vitamin D. Again, in the last 15 years here in sunny California, I can tell you that 90% of my patients are deficient in vitamin D. So unless you're a daily sunbather, you are deficient in vitamin D. 2 studies published in Neurology, again, highly respected peer-reviewed journal, showed that if you have a vitamin D level less than 25, your dementia risk is 2.7 times that of someone with a vitamin D level at around 50. So we'll talk about test numbers in a little bit, but vitamin D is important. So big disclaimer as I put up dosages here, these must be tailored to each individual, so please discuss this with a trained practitioner. You would want to use extra caution if you have any issues with your liver or kidneys, or if you're on prescription medications or blood thinners. But in general, these doses listed here for magnesium, D, turmeric, and omega-3 are reasonable and safe for the healthy individual. And I don't plug things often, but I'm going to plug consumerlab.com. For the price of a cup of coffee per month, you would be supporting a third-party testing system. So they publish third-party tests of supplements in particular brands to make sure that what you're buying has what it says on the label, to make sure that these supplements are free of contaminants such as heavy metals, and every single newsletter that they publish is backed up with research and references. So if you're at all curious about nutritional supplements, this is a really high yield investment for you. I will just say that most physicians are not adequately trained in supplements. So yes, talk about it with your practitioner, but also be informed on your own as well. So another common question that I got from the Q&A submissions: do my medications increase my risk of getting memory issues? Well, we already talked about sleeping pills, and again, before I put up the slide, do not stop any of your prescriptions without talking to your practitioner, okay? But this is just a list on the left of the most common drugs that are found to increase dementia risk with chronic daily use. The ones that I highlighted are the ones that I either got a question about or the ones I see most in my practice. So the first one is diphenhydramine. This is found in Benadryl, which is an antihistamine, but importantly, this is also what's found in a lot of the PM products. So the over-the-counter sleep products, Tylenol PM, Advil PM, the PM is typically Benadryl or something like it. Benadryl has been found to increase the risk of dementia about 2-fold when used regularly. Ativan is a common anti-anxiety medication. Somebody asked about Paxil, so I highlighted that, and then Ambien. Now on the right are possible alternatives, so if you are on any of these medications daily, you can perhaps bring this list to your doctor and see if they can safely switch you to something different. Do not stop medications on your own. Okay, we talked a little bit about numbers pertaining to vitamin D and good research on vitamin D. So I'm going to throw up some basic tests that most of your doctors should be testing on you regularly anyways. These are going to be things like your blood pressure, your cholesterol, your fasting glucose, your fasting insulin, high sensitivity CRP, which is an inflammation marker, your vitamin D level, and that body mass index, which is really how big that belly is. We want to get that belly off, right? So I'll make the note that normal results may not be optimal results. And one example would be the vitamin D. At most of our major labs, a normal vitamin D level is anything over 20. But as I just told you, the research study said anything less than 25 is a 2.7-fold increased risk of dementia. So for purposes of the brain, well shown, but also immune system and bone health, I really try to get vitamin D levels to at least 40. Same thing you'll notice with fasting glucose. Most fasting glucose tests will say you're fine up to 100. But in reality, when we're looking at decreasing inflammation of the brain, I like my patients to get their numbers into the mid-80s. So this may involve changing the diet, exercising more, getting that belly fat off, okay? And then strict blood pressure regulation as well. Most of the patients going into their doctor's office will be told they're okay. Doctors are great at diagnosing high blood pressure. We're terrible at actually making sure you're under control 24/7. So I encourage you to buy a blood pressure machine if you have high blood pressure and start knowing your numbers. Okay, just a brief question on hormones. Question is, my mother seemed to have more memory issues after menopause. Do hormones play a role in dementia? So most of the men here have women in their lives, so this kind of pertains to everybody. This was a prospective study published in Neurology in 2017. And what this study showed that in a select group of women who chose to start hormones within 5 years of menopause and chose to continue them long term, there was an almost 50% decreased risk of dementia. Now, obviously, the topic of starting hormones in menopause is a loaded one. We got to balance it with cancer risk, family history, also what type of hormones are being used. There are very good bioidentical hormones now that are FDA approved. So if you're going to be on a hormone, ask for bioidentical. But the data shows in multiple studies now that when started within 5 years of menopause, hormone replacement may decrease the risk of dementia in some women who are susceptible. Okay, the topic of genes, okay, hack your genes. So I made reference to the ApoE4 gene. So each of us have 2 copies of the ApoE gene. We get one from our mother and one from our father. And there are various ApoE genes, APO2, 3, and 4. So this is a graph showing on the x-axis the different combinations, on the y-axis the approximate lifetime risk. So now with availability of genetic testing like 23andMe, I have a lot of people bringing in their test results. So in the worst case scenario, if you had 2 copies of the ApoE4 gene, the risk is about 50% of developing dementia. Now the question I would pose to you is, what about the other 50%? 50% of the people who have 2 copies of the ApoE4 gene are just fine. What are they doing to be just fine? Now you know. This is what they're doing. You don't need a doctor to tell you this, right? They're choosing good foods, time-restricted eating, making time for sleep, doing their breath work and meditation, getting exercise, avoiding the toxins, doing a sauna when they can. This is how you biohack your genes. Okay, another question. Can dementia be reversed? My mother is starting to forget things. So this was a prevention talk geared toward the average 30 to 60 plus year old. Once dementia is actually in progress, that's a whole different conversation. These are the foundational things to do, but there is more we can do from a strategy standpoint. I'd like to empower you. If you know someone who has early signs of dementia, this is probably one of the best practical books you can read. It's called The Alzheimer Solution. There's a couple, that's the Sherzais, and they're actually down in Loma Linda, California, doing a lot of research. I encourage you to buy and read this book. It's a very practical how-to guide. Another book called The End of Alzheimer's by Dr. Dale Bredesen. So he is a neurologist, and his lab mainly focuses on reversing Alzheimer's. This book is, if you're really interested in the pathophysiology, the first half of the book really is pretty science-y, and the second half is a lot of how-tos. So that's another good resource for you. The apoe4.info is a support forum that is grassroots but has a lot of really great information. So again, if someone actually has dementia and you've read the 2 books and just want more support, that's a great way to find it. And then I have a reference to a great podcast called Broken Brain there. So let's see here. We've got about 10 minutes left. We can probably take some more of the live stream questions back there. Yes.
We have a question online. Is it true that the keto diet is good for the brain?
The keto diet. Okay, so that's a great question. Is the keto diet good for the brain? So we have many studies on the Mediterranean diet and the MIND diet. So prevention, long term, that's what I would recommend. Now, the brain depends on sugar in order to function. Those neurons, those brain cells depend on sugar. Not just sugar, but the sugar's ability to get into the cell. That's called insulin sensitivity. When we have weight gain or unhealthy lives, the body starts to lose the ability to get the sugar into the cells. So then the neurons can start to decline because they don't have a fuel source. So fortunately, the brain actually has an alternate fuel source called ketones. So in order to get ketones, one way to do that is with a ketogenic diet. Now, a ketogenic diet is a very restrictive diet that is mostly fats and oils, very little protein, very little carbohydrate. My 2 cents on that is we do know that when the ketones are available and accessible to a declining brain, the brain functions better because it's getting the fuel source. But a ketogenic diet in a young individual may not be the best thing long term. If I have someone who's trying to optimize and their glucose numbers are off, their insulin levels are off, their CRP is off, they're a little bit overweight, I might put them on a ketogenic diet for 3 to 6 months, really to help get that insulin sensitivity back, kickstart their weight loss, but it's not something I generally recommend long term. If someone has active Alzheimer's, there's a few small studies showing that a long-term ketogenic diet may actually help their brain function, but the dropout rate of these studies are very high. It's very difficult to do a truly ketogenic diet.
Another online question, is coconut oil or MCT oil helpful to prevent dementia?
Okay, good question. So it piggybacks off of the ketogenic question. So the body can make ketones out of coconut oil and MCT oil. Again, the data on this is very limited. And in fact, the few studies I've seen have shown that it's not so much as beneficial for the ApoE4s, maybe for the ApoE3s. The other thing is the side effects. So if you look at MCT oil, in order to get enough to actually make a difference, you're pretty much having diarrhea every day. So I would really stress the foundations of what we talked about. MCT oil probably isn't gonna make or break whether or not you get dementia.
Another online question, do puzzles or coloring books help to prevent or delay dementia?
Okay, puzzles, coloring books. So yeah, one of the multiple choice questions referenced some computerized games called Brain HQ. The reason why I just mentioned that is they have a lot of studies showing that when done regularly, these brain games, including puzzles and crossword puzzles, can help to foster growth of new neurons, which can also help decrease dementia. But in reality, learning anything new, learning a new language, learning how to dance, listening to music, just cultivating hobbies. I think the best thing to do is do something you like and challenge your body.
So then piggybacking off of that, can music therapy help combat dementia?
So I haven't seen specific studies that music therapy combats dementia, but we do know that music helps to stimulate the brain. And people who already have dementia, putting on the music from when they were growing up can oftentimes help them recall things. So what we do know is that certain exercises that involve music, such as a Zumba class or dancing, seems to stimulate the brain a little bit more than just regular exercise alone. So music's important in general. I encourage it in your life, but doesn't specifically decrease dementia.
And then I think we have time for one last online question. Does ADD or ADHD result in a higher risk of dementia?
So again, I haven't seen any specific studies looking at ADHD and dementia risk specifically, but I would think about the concept of the hyperactive brain in general, and are we doing what we need to bring down the inflammation in the brain? So I would probably approach it similarly if someone did have ADD with the same foundational recommendations. For any additional questions for those in the room, I'm happy to talk with you afterwards. So for those of you participating, here's your code for the Sutter Health Wellness Program. And I'd like for you to all thank yourself for making the time to be here today. It's certainly been my privilege to share this information with you. And I wish you all vibrant health and robust cognitive 401ks in the future. Thank you.